Hi, everybody. Welcome to another research update for lipedema. I'm Leslyn Keith, and I'm with Lipedema Simplified and Lipedema Project. And I like to get together with you a couple times a month to review some recent research that is happening out there that is of use for someone who has lipedema. And I got a really good paper that I want to go over with you today. Be sure and post things in the comments about hey, just where you are in the world and what's going on where you are. If you have any comments about the paper or other things you would like to share, go ahead and post those. I like to see who's out there. So today, the paper I have for you is the effects of shock waves and deep oscillations on lipedema. And this was a paper that came out of Chile, Santiago, Chile, which is pretty cool. I hadn't seen a lot out of that area in the world. And thank you to Kathleen Plavican, who alerted me about the paper. I will have a link to the abstract is going to be with this live. So you can get the abstract. If you would like to read the whole paper, it's behind a paywall. So if you find after I do this review that you would like to read the paper yourself, email me and I can send it to you. That is Leslyn@lipedemaproject.org. So this paper, it was published in the Journal of Aesthetic Nursing in March of 2024. And what they were looking for, they wanted to see the effects of shock wave and deep oscillation on the symptoms of lipedema. And so just a couple definitions. If you are not familiar with shock wave therapy, this is a high energy acoustic sound wave that you use a handheld probe and you go to the area that you want to affect, and it delivers those sound waves to the tissue, and it can break down scar tissue. It can increase blood flow. It can stimulate tissue regeneration. It can also reduce the oxidative stress in the tissues. This is what they found in other studies. There's been some small studies out there with shockwave therapy before on lipedema, but not a whole lot. And so a lot of our information comes from using shockwave on other populations. And then deep oscillation. This is an intervention that uses a combination of pulsed electrostatic attraction and friction to produce oscillations that act several centimeters deep on the body's tissue. It actually can go 3 to 4 centimeters deep from the skin. And so it can go from the skin all the way to the muscle layer, and it can have an effect on that area. And it's said to, different research has shown that it helps reduce swelling, it can improve wound healing, and it can strengthen the skin, actually. And it does help reduce inflammation in the tissues, and it can be especially useful for pain. So they wanted to see what these two modalities would be like for symptoms of lipedema, either alone, isolated, just doing that modality, or combining them both together. And so they got 33 women to volunteer to be in this study. They all had lipedema. They all were between the ages of 20 and 50 years of age. And they also had a BMI that made them to be what they call grade 2 obesity. So I believe that is probably like a 40 BMI or above. And they couldn't be in the study if they had diabetes, if they had a history of kidney problems, if they were pregnant or had been pregnant in the last 12 months. They can't be undergoing any other lipedema treatment at the time, or hormone therapy at the time, and they couldn't have cancer. And so they had these 33 women, and they were going to be in this study for 5 weeks. And so they were going to get treatments once a week. And it was going to be carried out at this physiotherapy clinic, as I said, in Santiago, Chile. And they were going to be treating just one leg. So they would have one leg that was a treatment leg and the other leg that they were going to compare to. And what was cool is that they had they divided them into 3 groups. And so they had one group that was getting just deep oscillation, and I'm having trouble saying that word today, oscillation. And another group that was getting just shockwave, and then another group that was getting both. And so now they can compare the results to themselves, the treatment leg versus the non-treatment leg, but then they also can compare it between the three different groups and see how they did for those different things. And so let's look at the results. I think this is an interesting study. And so interestingly, let's just first start looking at baseline, because they divided them up into these three groups, and they pretty much were very similar in all their baseline characteristics. They had average weight and BMI, and their girth measures and their body composition was pretty much similar between the three groups. That's a good place to start. And so now comparing how the three groups did. So first in girth measures, all three groups showed decreased leg volume by the girth measures. So everybody did well with either just doing one of those modalities or combining them together. They did well. But the group that combined the two modalities together did the best. That was really interesting. And then one of the things that they were looking at was they did a body composition scale so that they were able to see the percent body fat and the visceral fat and their percent muscle mass. And so they wanted to see, did these modalities have any effect on the fat? And interestingly, neither the shockwave or the deep oscillation alone had any effect on that subcutaneous fat that is usually lipedema fat. Only in group 3, where they had both those modalities combined, did they have an impact, and there was a significant reduction in percent body fat in that group only. That was interesting. And then when you compared in each participant the treated leg versus the untreated leg, again, everybody in all three groups, they had a decrease in girth measurements. So everybody reduced in volume. And but once again, only in group 3, when they compared the two legs, that group had the most significant decrease in volume when we put those two modalities together. And then that was also true with the decreased body fat. Only group 3, when they compared the one leg to the other, that was the group that had a difference in between the two legs in percent body fat. Interesting also, they were also looking at the visual appearance of the skin. You know how with lipedema, one of the characteristics that we can see is that the skin can get dimpled. It can look like a corrugated kind of mattress-like. It's not smooth, particularly when you get into the more advanced stages, stage 2, stage 3. And only in group 3, where they combined the two modalities, did you have visually a smoother skin when you compared the two legs? Very interesting. So I thought this was a really nice little study. It was the first time to combine these two modalities and see what would the effect be on the symptoms of lipedema. But it had several limitations. Of course, it has a small sample size. So we only had 33 participants, and then when you put them into three groups, then you only have 11 in each group. It was a pretty short duration, so only 5 weeks, so they each got 5 treatments. Pretty amazing, though, they had some significant differences in just those 5 treatments. That was pretty neat to see. And one thing I wish they had done, though, is I wish they had done pain measures before, at baseline and then after they finished the 5 treatments. And I would have liked to have seen what was the impact of these two modalities, either separately or combined, on pain. That would have been nice. The authors also suggested that, wow, wouldn't this be good to do if we also had tissue samples? And let's look what's happening at the tissue level with these two modalities. Is there actual tissue reorganization happening as a result of doing these modalities? So they would have loved to have been able to do tissue samples at baseline and again after the end of treatments. So in conclusion, they say that the data really strongly suggests that combining these two modalities could really, they enhance each other, they augment each other, and it could be a really good treatment strategy for symptoms of lipedema. And it just said possibly we're looking at improved tissue and skin health with using these modalities. We wouldn't know for sure though unless we did those biopsies. They did do ultrasound, so I think you can see some reorganization of tissue through the ultrasound, but tissue samples would be even better to do that. So a really nice study. And we're always looking at what can we do to enhance the treatment of lipedema, and therapists that are trained to help people with lipedema are always looking for what would be good modalities for me to be able to use at my clinic with my patients who have lipedema. So if you are looking for more about that, I have 2 strategies for you to find out more about various modalities that are going to help treat lipedema, either if you are a therapist wanting to do treatment or you want to get treatment for yourself or a loved one who has lipedema. There's 2 things coming up that are really going to help with that. One is I'm going to be doing a free webinar coming up in August, on August 8 at 6 p.m. Eastern. And we're going to explore several different intervention opportunities that we have for lipedema. And not going to be able to go in a lot of detail, but you're at least going to have some ideas of some things that you may want to get trained in if you are a therapist, or if you're a patient, and you can look into those modalities and see if your therapist can do them for you. So that's going to be happening on August 8th. I would really highly also recommend that you sign up for our Heart to Heart event that's coming up in September 27, 28, 29. Our virtual Heart to Heart event conference is going to be happening. And the big thing that's going to be happening is this: we're going to be talking about holistic strategies to managing lipedema and lymphadema. And a lot of these different modalities are going to be talked about at that. So if you were a therapist that needs to know more about how to help your patients with lipedema, or if you're struggling to manage your own, you're going to want to be at this event. And you're going to want to sign up early, because right now we have that special early bird discount with a 75% discount. This is what you want to do. You want to get in there now and register now before that price goes up. So use the links below, find out more about both the webinar and the 3-day event, where you'll find out more about all these strategies for managing lipedema. It really in depth after 3 days, you can imagine. So check both of those out. I'm just going to quickly just look at any comments here to make sure that I answer any of that. One person is saying it's not complete, but you're getting with that link I gave you for the paper I just reviewed. It's not a complete article, but it is a little bit more than an abstract. If you do want to read that whole paper, remember, email me, Leslyn@lipedemaproject.org, and I can send you a copy of the paper. We actually contacted our friends in the UK and said, do you have this paper? Because Kathy Clavican let me know about it, and then I couldn't get the paper anywhere, but our friends in UK were able to get it. Hi, Dottie from Indiana, and Diane from the UK, thank you. And Jean is here. Jeannie is from Sacramento. Thank you. And Terry from San Antonio. Wonderful to have you here. Thank you for being here. Here's Patsy also is here. And I don't see where you're from, Patsy. Cheryl is from Wisconsin. Okay, great to have all you here. I got a couple other announcements I want to tell you about. And one of them is, if you're looking for a provider, you have figured out that you probably have lipedema, or maybe you even got a diagnosis. Now, where do you go from here? You need to have a provider. You need to have someone who is a little bit cognizant of lipedema and some things that they can do for you. And so this is our provider directory. Check that out, because this was put together by people like you. They went to that person and they found that that person helped them. And so they asked us to list them on the directory. It's a worldwide directory. Probably most are in North America, but it is worldwide. And so go to your area of the map and see who's around you. You'll also notice listed below the map, it has different types of providers. If you're looking for a surgeon, or you're looking for a doctor who understands lipedema, you're looking for a therapist that can help you with treatment, you want to click on whichever of those types of providers you want to do, or you just say all, that's okay too. And then they will pop up on the map, and it has their contact information. If you find that there's no one near you and you have to travel, you really want to make those calls first to make sure that you're going to someone who's going to be a good fit for you, and call them and talk to them. So that's our provider directory and our link for that. And let's see what else. Oh, okay, you need help getting them a diagnosis. Maybe you're not even sure if you have lipedema, but you would like to get a diagnosis, or you're pretty darn sure you have lipedema, but your doctor doesn't know anything about it. Well, check out our link to this handout. It's just a front and back one-page handout, a roadmap for diagnosing lipedema. This gives the basics to your healthcare provider to help them work with you to see if you indeed have the diagnosis of lipedema. They can use this handout. If it's not enough information for them, you can also give them our paper, a proposed framework for research case definitions for lipedema. This gives a more detailed look at this one-page handout, and it tells exactly, okay, we have this characteristics. How do you assess it? How do you palpate? Where do you look? How do you question and discuss with your patient? And so that will give them even more guidance on helping to do diagnosis. But if you feel like a good one-page thing would be a nice introduction for your healthcare provider, here it is. Follow that link and take that to your healthcare provider, and that might help you get diagnosed sooner, or someone you know that needs a diagnosis, and help them get that diagnosis in a more timely fashion so that you can start getting treatment. Let's see, what else do I have to do on here? I want to make sure if there's anything else I need to tell you about. I think I did everything. Oh, check out our calendar of events. This is really cool. So I quite often, when I do these Facebook Lives with you, I tell you about some event that's coming up, and maybe you forget to check it out, or what was that thing she said? You can go to this calendar. So we'll give you that link for our calendar of events, and it has on there, you got the date, they got the time, and you can also have a link on there to more information about that particular event. So you can go to that. It is also available if you go to the website Lipedema Simplified, lipedema-simplified.org, lipedemaproject.org. And you can also get the calendar of events from there. You'll see in the upper right-hand corner, I believe, there's a button that says calendar. Or events, one of those. But that will help you to know everything is coming up. All of our wonderful events and activities are coming up. I think that is everything. There's my email again, leslyn@lipedemaproject.org. And so I'm going to be with you again the first and the third Thursday of next month. I will see you again really soon, I hope. Join me next time. And until then, see you soon. Bye-bye.